fall down in the sickness of my soul when nobody knows, containing all my containing all.
Hi, I'm Luann. Welcome to the Woman to Woman Show. And we're talking about a really important subject this month, trying to kill pain and not patience. I know that's a strange concept here in Oregon, but we have with us today a wonderful guest. He has such an impressive title. I have to read it so I get it right. Dr. Kenneth R. Stevens, Vice President of Physicians for Compassionate Care, Professor Emeritus, did I say that right? Of Radiation Oncology at OHSU. You're a busy guy.
Yes, I've been in Oregon for about 40 years as a cancer doctor.
I can't believe it. And, you know, I got to tell on you a little bit. This is a Saturday, and this is probably the last sunny Saturday of October we'll ever get. And you're here giving of your time so that people in Oregon hear the truth about doctor-assisted suicide and why it's not such a great idea. And I know you've got a lot of background, you've got a lot of knowledge. I want you to kind of jump right in and tell us what motivated you to get involved, give up Saturdays, give up your free time, pour your heart into your work to try to convince people this is evil disguised as good. Can you kind of start out?
As I indicated, I've been in Oregon for 40 years as a cancer doctor. My specialty is radiation therapy. I've probably taken care of about 10,000 cancer patients in Oregon. And I was appalled and surprised in 1994 when the voters of Oregon passed by a very slim margin to legalize assisted suicide. And it sort of turned my world upside down and the world of a lot of other doctors.
Right.
Because I went into medicine to help people, to cure a lot of people, to relieve suffering, to help them. And I could not see the role of a doctor in causing a patient's death. What I have learned is that when a patient asks for, or when a patient receives a prescription from a doctor, that's called an order. It's a directive. If you're in the hospital, the doctors write orders, so that when a patient receives a prescription, what they're really receiving is an order from their patient, ordering them to die, and that's not what doctors should be doing.
No,
it's the opposite. I just felt that I needed to be involved. I needed to learn more about it, so I really educated myself. I've developed a large file of papers, and the more I've learned about it, the more danger I see in the legalization of assisted suicide.
well, danger isn't a word you hear about, and it certainly isn't a word you ever read in the paper when they're doing stories on this subject. I know, by the way, I got to tell you, the website you guys have, which we put up in a previous show, and I need to plug that because it's so good, PCCEF, Physicians for Compassionate Care Education Foundation.
PCCEF.org.
.org, yeah. Sorry, make sure that gets on the screen. You're a brilliant writer, and you and Dr. Toffler, both of you, are absolutely wonderful at getting the point across of why this law is dangerous for anybody suffering from a terminal illness, or the elderly, or the disabled. Why should these people be worried about this? Isn't this just kind of a great thing that, people are saying, well, why isn't this a good idea?
I was talking to a neighbor recently, and she was telling me about her mother who had cancer and was having some problems, and she was getting more feeble, and so she went to the hospital, and the doctors determined that she had pneumonia. And so the doctors turned to this daughter and said, "Do you want your mother's pneumonia treated?" And the daughter said, "Well, why don't you ask my mother?" And so she said, "Mother, you have pneumonia. Do you want it treated?" "Of course I do. Why wouldn't I?" But see, the doctors were presuming that because she had cancer, because she was failing, because she had pneumonia, that they weren't about to treat her pneumonia
Just asking that question is an insult to me.
But that's the attitude of so many doctors. And so there's a real concern about medicine costing too much.
Right.
And in fact, Derek Humphrey, back in 1998, wrote or he was interviewed in the Oregonian, and the title of the article says, "Economics Makes Sense for Euthanasia."
And tell what he's in charge of or who he's with.
Yeah, Derek Humphrey is in charge of was in charge of the Hemlock Society that became
Right.
Compassion in Dying, Compassion in
Yeah,
Choices.
by the way, they didn't like the name Hemlock Society. Isn't it all about
It's about language.
language?
And that's what we've learned, that
Yeah.
you try to manipulate language in order
You can fool
to
people.
manipulate what's happening in society.
Right. And have you actually had people ask you to write them a lethal prescription?
One of the interesting things that happened a few years ago was, again, the name of our organization is Physicians for Compassionate Care,
Yeah.
and the organization that's a proponent of assisted suicide has been Hemlock Society or Compassion in Dying or Compassion in Choices.
So
And
the name is very
so people
similar.
get kind of confused. And about 3 years ago, when the Oregon Medicaid or Oregon Health
Right.
Plan cut out tens of thousands of patients in terms of what they covered for their prescriptions,
Okay.
a fellow just out of the blue called me, thinking
Yeah.
I was
The other guys.
other organization,
The bad guys.
and said that he
Yes.
had chronic back pain.
Yeah.
He did not have terminal illness. He had chronic back pain. He says, they have cut my pain meds. They won't pay for my pain meds, but they will pay for assisted suicide.
Wait a minute.
Will you help me?
He wasn't terminal.
He wasn't. But
He had back pain?
He had back pain. But his view, and again, he wouldn't qualify under the guidelines of the law, but he was so upset that, you know, the state, the only way
He
I
was
can get
without
pain,
hope.
the only way I can get pain medication is to do this.
Is to die.
There were some other problems. There were, again, the Oregonian ran a big series about 3 years
They
ago.
sure
and
did.
This was from the Portland Tribune, but these were fellows and had AIDS. It shows all their medications. They were losing coverage for their
Right.
viral medications. There was a woman whose daughter in her 20s was mentally ill. She lost the medication that she should have been taking. She committed suicide.
So this
So
is,
we have a
this is a big time
people are
factor
concerned-
is
yes,
cost.
I think cost is a big factor.
And
Yes.
and so by saying Oregon Health Plan has been saying to people, we're going to cut your care here, here, and here, but we'll pay for suicide.
Right.
That's actually happening right now.
Right. What I discovered, and this was, I was sort of looking at what they do cover and what they don't cover in the Oregon Health Plan. I guess it's a prioritized level, so that the coverage is based on the diagnosis. And ever since the Oregon Health Plan started, if a patient, and again, I'm a cancer doctor, so I was very aware of
Right.
this, and I actually learned about this when the state refused to pay for a patient.
Okay.
So if a patient in the Oregon Health Plan has a cancer diagnosis and the likelihood of them living 5 years is 5% or less, they will not pay for any what they call local treatment. They won't pay for surgery. They won't pay for radiation treatments. They won't pay for anything. They will pay for what they call palliative care.
Okay.
And assisted suicide is
Which
considered
is comfort care, basically.
comfort care, and comfort care does include assisted suicide.
Comfort care.
Comfort care. It's a category.
Includes
Comfort care is a category.
Well, how
And
comfortable are you when you're dead?
I can get rid of your pain.
I don't know. Is that, yeah, I mean,
Yeah.
how crazy has this become? You know, I said it in the other show, but I really mean it. Driving to the studio today, I'm thinking to myself, good heavens, I can't believe the topic we're coming to talk about is really happening in Oregon. And you're right in the thick of it, and I know it's hitting you from all sides. And
We had an interesting experience yesterday. There's a Dr. David Jeffrey, and he's a well-known palliative care doctor.